Anterior Cervical Discectomy and Fusion. General. Introduction. Can you point to the vertebrae? Choose one of the following options. Correct. Can you point to the discs? Choose one of the following options. Correct. Which of the following two discs is herniated? Choose one of the following options. Correct. Are heart attacks and other anesthesia-related complications common during and after spine operations? Select yes or no. Correct. Anesthesia is now very safe. However, the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as heart attacks and lung problems. Are infections very common after spine surgery? Select yes or no. Correct. Infections are very rare. Though rare, infections, bleeding, and scarring may occur. Paralysis and weakness are very common after spine surgery. Select true or false. Correct. Paralysis and weakness are very rare in spine surgery. Although these risks are rare, they can still happen. It is impossible to injure the blood vessels and the breathing and feeding tubes in this surgery. Select true or false. Correct. It is very unlikely for the blood vessels and the breathing and feeding tubes to be injured during this surgery, but it is not impossible. The screws of the plate will often break. Select true or false. Correct. Even though it is very unlikely for this to happen, it may still occur. The operation is always successful. Select true or false. Correct. The operation tends to be very successful, mainly in relieving arm pain. However, it may fail and sometimes the bone plug may become displaced. There is also a small chance that the symptoms will become worse than before the surgery. Thank you for using Explain.